Good morning, the early risers and the morning crew. Good to see you all. As a disclaimer, I am no longer an employee or staff at the OTA. I severed ties with them via retirement in 2017, which is already 8 years, hard to believe. But I come by for coffee and treats that I help myself to liberally there and speak to the staff. And I'm on very good terms with David Martin, the executive director, who still lives and works down the road in Wake Forest, North Carolina. So this is a refresher course in that I am speaking about things which I no longer have any direct input, but have awareness and knowledge of. Also, there has never been an assessment to look at cause and effect amongst participation in any course material, review courses. That includes Mark Miller's course, who says that if you take his course, you'll pass with flying colors. We don't know. No one knows. But if you do your homework, and I'll highlight the new web-based learning assessment, if you do your homework and keep up with events, the chances are more than 97%, as someone who's board certified, you will recertify or successfully participate in the maintenance of certification. This is just for public consumption and for those of you who are certified. The ABOS is not part of the Academy. It's not part of the AOA, though it does take members who are nominated by those groups. It serves the interest of the public and has a degree of separation from those orthopedic organizations, which many, if not all of you, are members. This Gallup poll from the early 2000s was sponsored by the Academy, and surprisingly, nearly 3/4 of the people surveyed at that time felt that they would choose a board-certified doctor, and that was for orthopedics, so it's probably higher amongst primary care. And it's never been repeated, and no one wants to repeat it for fear that the numbers may not be as great, or they may be greater. And the feeling that we are like airline pilots going to the simulator every 6, 12, 18 months and being recertified by our peers, that's never going to happen. There's a very strong movement afoot in the board community, mostly from family medicine, internal medicine, pediatrics, to shorten the timeline. We now have a 10-year recycle for maintenance of certification. These other primary care boards want it as low as 2 years, or more commonly they agitate for 5 years. And the American board and a lot of the surgical boards have held off against this, and it has not happened. The web-based learning assessment, as I mentioned, that's the biggest recent change. The board did try a pilot to see if we could do the oral exams and oral recertifying exams without the examinee present. That pilot didn't pan out, and it never became part of the maintenance of certification cycle. I mentioned the length of MOC, same as the recertification before that. We've held that steady at 10 years. The naming of this process is something of concern because MOC gives a lot of people heartburn. And so the feeling is it's a toxic name and maybe it should be changed to something else. And that hasn't happened, but discussions are ongoing, and stay tuned for future developments. There is a periodic movement to have an emeritus status for people who certified and recertified at least once. That, too, is something you'll have to stay tuned. It has never been adopted by the board. So maintenance of certification evolved from recertification. We, as orthopedists, have a very high pass rate, and this number needs to be updated in light of the web-based learning assessment, which now has the first cohort of people who have recertified using that web-based module. The exams, whether you take a computer exam or an oral exam or you do the web-based, it's all patient-oriented. There's no basic science any longer in the questions or in the articles that are selected for you to review. You may take the exam 2 years before your certification expires, and that does extend for 2 years. So if your certification is due in 2027 and you recertify this year, that goes through 2037. You're not penalized for being a good citizen and recertifying early. And the subspecialty certification still requires passing an exam of one form or another in orthopedics, usually a subspecialty, and the specialty in sports medicine or hand. So MOC refers to a process, and any certified orthopedist may recertify. You don't have to be in practice, you don't have to be doing surgery, you just have to be able to draw a breath and have an active medical license to recertify. And those who wish to take an oral exam must be in practice, and that's a vanishingly small number nowadays. So the 10-year cycle has been upheld, and probably for the foreseeable future will be unimpaired by actions taken by other certifying boards. And it's more than just passing an exam. As with your initial certification, you were subject to peer review in your community. You had to take so many credit hours of knowledge-based learning, and you were assessed by orthopedists who have gone through this process fairly recently. We don't have people who are examiners or question writers who are more than 2 years out of practice. So the 2 to 3 year cycles that go for MOC are basically CME with several points given for self-assessment exam. You need to have an unrestricted medical license. If your license is in any way restricted by your state medical board, that doesn't penalize you. It just puts you on hold until the license issue is reversed or clarified. And there still is peer review. There still are computer exams at a computer center within 50 miles of where you're practicing. And those exams are, as I said, for the most part, patient and clinical questions, not basic science questions. The WLA, the web-based learning assessment, as I said, is now graduating its first class in 2025. You have 5 years during a 10-year cycle to complete successfully a process where you read these articles, 2 articles at a time, and you get questions afterwards, and you have to get 24 of the 30 questions that you're asked in a 6-week time frame. And once you do that, you're good till the next year, and you do the same with reading articles and taking computer-based questions on those. So this is very popular now. It's estimated that more than 94% of certified orthopedists are participating in this, and we think the passing rate's going to be even higher than that for the computer and oral exams for recertification. This is, however, subject to change. The Board of Orthopedic Surgery has 20 orthopedists and one public member. They meet 3 times a year. They're apt to make changes. However, they don't come quickly, and they are with plenty of advanced fanfare and explanation of how and what to do. I highly recommend you call the board office, which is the number there, and speak with someone if you have any concerns or questions and clarify it ahead of time. And make sure that you have an active, unrestricted state medical license. It's impressive each year that out of the more than 25,000 board-certified orthopedic surgeons, how many have restrictions on their license or they've let it lapse. Don't let that happen to you. Stay involved. Keep your license going. It's a lot easier than trying to get it back after it's been taken away for any reason. And you don't need to keep certifying if you are no longer required by the hospital or the surgery centers where you're working. So recertification via MOC is a voluntary process which may not, in the final analysis, even be necessary for you in your particular instance. Thank you, and I'll remind you that I'm here. I'm giving the last lecture, I think, on Saturday, so I'm here from beginning to end. Stop me, talk to me, ask questions, and I'll try and give you my best answer. Thank you for your attention.